Well, wonderful. I think we'll get started. Good morning, good afternoon, good evening, everybody who's joined. Feel free to turn your cameras off or on, depending on your bandwidth. We'd love to see your faces and interact with you all. But we know that sometimes the internet isn't as reliable, so feel free to do as best for you. Welcome to the clinic. We're going to begin peer-to-peer discussions shortly. I have a couple of bits of housekeeping for everybody. So you should have the information for the slide in the chat. That's where you can post your questions as we go through. There is also a Google document for this clinic. There are two clinics today. So there's this one this morning. This is the first clinic, and then one later on European time. And the Google document will be live for the whole conference. So if you have questions now that you'd like us to address in this clinic, but if they, and we will do so, but if they occur to you later on in the day or you'd like to follow up, all of our experts will be plugged into that document and be able to answer your questions in real time or take problems away to their community and come back with answers for you over the course of the event. Thank you so much for joining us. One thing I should say is that it would be wonderful if everybody could introduce themselves in the chat. Just say where you are, where you're from, organizations you're representing, or your background. We'd really welcome an engagement with you. And what we'll do with the experts in a moment is get them to do a discussion, an introduction for you, so that you get a sense of who we are and where we're from, and help tailor your questions. And then after that, we'll just jump straight into it. So I don't think there's anything else on the housekeeping to mention. Feel free to raise your hand, to unmute yourself with any questions. We are keen to make this as interactive as possible. So I think there's 4 different ways to contact us. So please do whichever way you feel most comfortable with. So we will take a couple of minutes now to go over to the Slido to answer any questions. And I can see there's a couple already come in, which is fantastic. So whilst you are all introducing yourselves in the chat, us experts will also be introducing ourselves. So maybe I'll come to you, Stefan, first, and say to you, give us a couple of bits on you.
All right, excellent. Good morning, everyone. Good afternoon, everyone, or good evening. Yes, my name is Stefan Urban. I'm a social protection specialist at the International Labour Organization in Geneva. Well, I've been working for the ILO since 2015. I worked a lot on financing. I developed the office's fiscal space handbook with some of my colleagues here. I currently cover a number of issues, including shock responsive social protection, extending social protection to migrants and to the informal economy. So these are just a few areas of my work which I have covered during the last 5-6 years. Before joining the ILO, I worked in Southeast Asia, managing projects on social policy and human rights for the EU Commission. And my very first experience was actually in the private sector, working for a reinsurance company. And managing the life and managing a portfolio of life and health insurance products. So yeah, that's from my side. Welcome, everyone.
Wonderful, thank you. And over to you, Benedict.
Thanks, Sophie, and good morning, good evening, everyone. My name is Benedict Signer. I work in the World Bank, based in Singapore now. In the World Bank, in the team I'm in, we call it Crisis and Disaster Risk Finance. What it means is we work with governments on financial planning for shocks. So really, as part of the broader World Bank's work on shock response, on risk management, on disaster risk management, on social protection, we really focus on that narrow part of working with mostly Ministry of Finance, saying how can you fund this liability that you have from disasters, that you have from shock response, and how can you most efficiently set up the financial plans for that, pre-arrange the funding for that, and link that to the disbursement channels. So for that, most of my work now covers the work across Southeast Asia. I work in the Philippines, Indonesia, Myanmar, etc. I also lead our work in implementing what we call the Global Risk Financing Facility, It's a multi-donor trust fund financed by Germany and the UK to pilot the embedding shock responsive systems and risk financing and preparedness plans within larger World Bank lending operations, and saying how can, for example, social protection systems embed this additional component that pre-arrange the financing and link it directly to the disbursement channels. Thank you.
Thank you. And Dinanath.
Hello, good morning, good afternoon, good evening, everybody. I'm Dinanath Bhandari. I'm working in Oxford Policy Management in Nepal. So my role is to support national policy on disaster risk reduction and management. During that, I get involved into shock responsive programs, actually in policy and programming. So recently, World Bank has supported Government of Nepal to prepare shock response disaster risk financing strategy. So I was involved in reviewing and revising that draft. The draft is yet to be approved, but it is at the final stage. That is sort of good news that I have heard yesterday. Also, as part of disaster risk management policy activities, I have to go through shock responsive programming, forecast-based financing, because these are the part of disaster preparedness and response. For many years, over 15 years, I worked in establishing community-based flood early warning systems, which have been really useful instrument to effective disaster preparedness and response, which the financing is getting benefit of. So really interested to learn and discuss from this clinic as well. Over to you, Sophie.
Wonderful, thank you. So I can see a few people have added in to the chat. So welcome everybody. So they've introduced themselves. I might feel free to keep using that function with any questions or any comments and introduce yourself. I think we should just jump straight into the questions as well. So there's a couple of questions specifically around funding core caseloads in the cases of future shocks, especially when financing for current caseloads is a challenge. So routine programs are struggling to be financed. And then another question so that's the first question on the list. And there's another question from Ruben from UNICEF around mobilizing internal resources and COVID in terms of DRF. I can see that those both got two thumbs up. So Stefan, I might ask you to address that first question about core caseloads, if you can, and kick off from there, if that's all right.
All right, excellent. Thank you, Sophie. Yes, well, first of all, there are many ways to expand your financing for social protection, for social policy measures. None of these avenues are, of course, easy. You always have to consider them in the political economy of your country in which you would like to address this issue. Like in general, what you have to look at is counter-cyclical spending is a key word among others. So increase your reserves in good times so that you can spend more during crisis. And for this, you have to have policies and mechanisms in place that prevent government from doing the opposite. Naturally, governments, especially when they are elected democratically and might not be around forever, they want to spend more when they can. So this is something you have to learn, and you have to set up mechanisms to avoid this. Now, let's get a little bit more concrete. Something you have to look at is how to increase your government revenue, of course. There are a number of ways to do this. Of course, you can first, this is the most obvious maybe, is to strengthen your tax system. So you have to look at efficiency and effectiveness of your tax administration. and the ability of the tax office to collect revenues and to make people pay what they are supposed to pay. So you have to, at the same time, you have to limit the incentives and opportunities for rent seeking and for inappropriate behavior. You have to implement voluntary compliance to expand the tax base. You have to have a strong enforcement framework in place with a sufficiently staffed tax office. It's important to have a strong enforcement framework, not just from a tax collection perspective, but also from a contribution payment perspective. So if you have a contributory social protection system in place, a social insurance system in place, then you have to have a strong enforcement framework in place that ensures that contributions are collected. You have to also create services that deal with the unique challenges posed by the different groups from which you are collecting taxes. You have to have clear laws and regulations in place. You have to forcefully combat tax evasion and limit illicit financial flows. Of course, these are just ideas and just a few highlights of what you have to look into. Of course, these issues are not easy. I mean, when we look at tax evasion, when we look at illicit financial flows, these are complex issues, especially in the case of illicit financial flows. You really have to address it from an international point of view as well, not just looking at your own country, but you need to collaborate globally in order to be successful on this specific issue. And it's also a longer term assignment that you need to carry out in order to increase your tax income.
Can I just a quick question there in terms of for funding the caseloads. Are you seeing an appetite in international donors to use and fund, so where you've got bilateral donors to fund caseload expansion, so whether it be vertical or horizontal? Is that a viable source for many countries to where revenue streams are coming from donors, or is it something that you're seeing more from multilateral donors where World Banks or others are investing in social protection to expand?
Yes, yes, these kind of opportunities exist. You can look at the various donors, the various IFIs that provide funding for these kind of, for strengthening social protection systems. But in general, of course, this is usually just like a shorter term measure. You should not rely on. So what you should always try to do is to expand your national resource mobilization, to expand your national revenue, so that in the medium and in the long term you can sustain your system by yourself. So you need to own the system. It cannot be funded in a medium and long term by foreign donors. What we also see currently is that the EU, for instance, is directing its budget support more and more towards these kind of social policy issues. We are working with them closely in a number of countries, and so this is also an option to work with the EU, to work with some of these more generous donors to fund your system.
Or to get technical assistance to support the technical steps you mentioned. Yeah,
this usually goes hand in hand, especially in our programs that we currently implement with the EU. We provide the technical assistance from the ILO, while the EU is providing the funds to strengthen the system, to strengthen the caseload that can be carried out by the systems. But just briefly to mention a few more things, then I will maybe give the word to our colleagues to extend to what I was saying. Now, there are, of course, ways of taxation that are more promising than others. You have to look at, of course, making sure that the tax system that you have is progressive. And here just a few ideas of what can be done in some countries where this hasn't been fully explored yet. You can look into sin taxes on tobacco, alcohol, and sugar products. For instance, in France, this increased the revenue substantially for the government, and also at the same time it had a very positive side effect from a health perspective. Turkey, Egypt, the Philippines have implemented similar measures. In Turkey, it was in 2010, I believe, that they increased the tax on tobacco. Then you have all these like airport and hotel taxes. You have arms and carbon taxes. You have, in some countries, you had financial transaction taxes that increased revenue substantially. This was the case in Brazil. This was just a temporary measure, but we've seen a really positive impact on raising revenue especially for social policy and social protection measures.
Is there a link that you could drop into the chat? I know all of this is likely to be on the ILO platform because it's so brilliant and extensive as a resource, but I think that would be useful to capture as we're recording the session, or maybe we could pop it in the Google document. That would be really helpful.
I can give you the references of the documents where you find more information, because of course the time is too short, so I cannot expand in all of the areas.
No. But really helpful practical suggestions. Thank you.
Just very briefly, something you should also look into is of course how to expand your social security coverage and the contributory revenues that you can generate. You have to have a national social protection strategy also in place that puts emphasis on the extension of coverage to the informal economy. First of all, because this is important. Second, because this is also a way to raise additional funds. Mm-hmm. So it's in a way self-financing. And then you have to look into public expenditure reprioritization. Is the money that you currently spend on social policy or on other areas, is it having the desired social or desired impact that you expect? So you have to do an analysis to make sure that you get the most for your money. After all, it's government money, but it's your tax money. Mm. Right. I will leave it here, and I can expand in all of these different areas and give you more examples if you would like to.
I think that would be really helpful. Thank you so much, Stefan. That's really great. Benedict, over to you. There's a second question from Reuben in UNICEF about valid lessons learned from COVID-19 in terms of DRF. Many countries have mobilized their own internal resources, budget reallocations, for example, and others have used ad hoc international lending. How much of that was pre-arranged, and to what extent could they be replicated in future shocks? There's also a question from Safula, the penultimate question on how insurance can be integrated with social protection to support future climate-related shocks. And I'm wondering if you can answer both of those at a similar kind of time. That would be great. Thank you.
Sure, happy to. If I may just a quick addition to what Stefan was saying on the previous question, is I think it's important also for everyone here to keep the realistic perspective, let's say. And what Stefan laid out is a long-term and large agenda of important reforms that can be taken. But I think what we need to keep in mind is that a lot of those issues are core Ministry of Finance issues. And to put it bluntly, frankly, nobody on this call will influence that at all in the short term or medium term. But working with Ministry of Finance all the time, tax policy is not something that changes in the short term. Tax policy is not something that changes easily. So it's good to have this long-term view. But I think what's really important is to keep in mind, if you are working on social protection, specifically on social assistance, on social spending, to me, the biggest gap and bottleneck I often see is that the people in the Ministry of Finance and the people in Ministry of Social Protection, Social Welfare, Social Assistance, whatever it's called in your country, they really struggle to talk to each other because there's often not the same language, right? You know very well who you need to deliver money to, how much and when, Ministry of Finance knows well how to manage liability, but they don't understand each other very well. So I think the best or the most important case you can make is to show the financial decision makers who are very used to saying no because everybody wants more money, but they don't do it out of a place because they don't like to give social assistance spending. Quite the opposite, because they have to make so many trade-offs and balances. So they want to support these programs most of the times. So I think the most powerful message you can get is to help them understand that, in fact, the system you're building is a more efficient way of spending the money the government is already spending anyway, right? And especially when looking at disaster response and shock response, the kind of transition. Next question now is, when something like COVID happens, or something much smaller, if it's a small landslide, small flood, or small drought, the government will pick up the tab in any case, one way or another, whether through a prearranged system or through ex-post interventions, unless you have international assistance coming in, and we can talk a bit more about this question of who pays, but one way or another, somebody's picking up the tab. So what you're actually doing through setting up those systems, you can make the money that you have go further and last you longer by having it more efficient, better targeted. I think making that case clearly to your finance counterparts, your finance colleagues, is very important, because that helps put it into a language that they understand, that they can start looking at the financial efficiency and trade-offs of when to finance and how to finance. Now, I think what we see from the COVID response, there was quite a bit of prearranged funding. I mean, I can talk mostly from the World Bank's perspective. That's what I've seen the most. And from the World Bank, there was quite a lot of prearranged funding flowing into countries for COVID response. There was also a lot of kind of emergency processed ad hoc funding, but a lot of it was prearranged. Now, this prearranged funding was not necessarily for COVID. In fact, none of it said COVID as far as I'm aware, but it was for disaster response, health shock response, or just general shock response, right? It's important to keep this these triggering conditions broad enough. And from World Bank, we had the primary two mechanisms for this. One was we call the CAT-DDO, it's contingent line of credit. It's a prearranged funding line which disperses in response to a shock. In this case, in World Bank's case, it's for natural disasters and health shocks. And that's the government can trigger it and release it. Now, that is budget support. So okay, when this flows in the Treasury account, the Ministry of Finance. The other main mechanism the World Bank has been using is what we call CERCs. Those are emergency response components, conditional emergency response components, which means that in a project, say in a normal social protection project, we finance the core load, there's one component which can reallocate funding. Or if it's building roads, something very different, there's one component which can reallocate funding without having to redo the project, redesign the project. It can take money and put it towards something unexpected like a shock response. Now, this is tied to specific prearranged an operations manual of how this money can be used. So that was quite a lot. But I think the key question is, what can you learn going forward and how to do more of this? And especially in the COVID recovery, or as government spending a lot on COVID recovery, to me, the key part of this is to say, how can you build a system? How can you institutionalize these mechanisms, right? The CAT-DDO I mentioned, contingent line of credit, it goes to the budget. Well, how efficient does it flow from the budget to the safety net afterwards, or wherever the government wants it, right? This is often a question. How can the government, how can partners, external partners, or civil society or international organizations help set up the system, the operating procedures, the rules, the triggers that says, well, this is how the money will flow efficiently, effectively, transparently. And I think this is something that government should look at in the COVID response and COVID recovery, where there is a lot of ad hoc systems, a lot of ad hoc funding. Say, well, how can these actually institutionalize those systems, set up the mechanisms? Leading to the next question, so here's the one you wrote in on insurance. Well, once you set up a mechanism, once you set up a system, that you can then ask the second questions. How do you actually fund this most efficiently? Right? Do you wait for when something happens, the government reallocates money? You say, well, you do a budget reallocation, a supplemental budget, submit it to Parliament, it might take you 2 months, they will mobilize additional money. That's one way, and it's a valid way in many cases. Or you say you wait for donors to come in and provide your funding. Or once you have a clear system, you can say, well, how can I leverage insurance for that? Because once you have a system that's, we could call it shock responsive, that has a clear defined target beneficiaries, that has clear triggers when it pays out, that triggers that you can quantify in advance, saying, I expect this to pay out on average once every 5 years, once every 10 years. Then you have a defined liability. And this is a defined liability that you can start insuring. You can go to the insurance market and say, but I will pay out if this happens, which I expect to happen with this probability. And how much does it cost me to insure that with you, to put this as part of a comprehensive financial strategy and plug insurance in there. So the takeaway message, I guess, on this is that when you look at insurance, make sure you look at the system as well beforehand that you insure. And actually, if you allow me just 30 more seconds, Sophie, the flip side of that is what we've seen quite often is that insurance is being promoted as a solution without thinking through the whole chain. And this is not about the insurance industry promoting it, or donors promoting it, countries promoting it. It's everyone looks for solutions, right? And insurance can be a very tangible solution. So it's very attractive. And it's supposedly very powerful. It's well tested for centuries as a risk management tool. But the risk is that if you only look at the financial mechanism, the insurance part, and don't spend enough time thinking, well, how does this connect to the channels that make sure the money reaches the right beneficiaries? Whether those beneficiaries are households, whether those beneficiaries are the Ministry of Transport, the rebuilds bridges, doesn't even matter, right? But if you don't think through this whole chain of how the funds flow, the financial management side, the public financial management side, what you risk is that you end up paying for the insurance, it pays out, and the money is stuck somewhere in a treasury account, in a ministry account, in some intermediary, and it doesn't flow. So I think that's a very important to think of insurance as the whole chain from where the money comes all the way to the final beneficiary. Thanks, Sophie.
That's brilliant. Thank you, Benedict. And Dinanath will come to you shortly, but just to answer Ruben's question as well. So one of the pieces of work that we've been doing recently at the Centre is an analysis of how the international system, so multilateral banks, the UN system, well, bank group, sorry, I should say, as an example, as well as other multilateral banks, have flowed money to national governments. We were talking about this in some of our preparatory calls for this. It's an interesting piece of research which is showing how much money is moving, quite substantial sums of money. But when the analysis stops short of understanding where once it hits the government balance sheet, it's considered dispersed, because those who are financing COVID or flowing money for COVID, that is their measure of a job done. And so another piece of work, which actually I think Benedict is from Ugo and the team at the bank on social protection, is understanding, right, once it's hit the government balance sheet, now how is it flowing, and how is it flowing through social protection? So we can put that, I think they've done a pretty substantial country by country analysis, which demonstrates how that money is then flowing through. So we can put both of those resources on to understand how disastrous, and some of those are disastrous financing tools, so things like CAT DDOs and other instruments, similar products from ADB. So you can get a sense of how money is moving to respond to COVID, and then hopefully begin to piece together how much is flowing through social protection systems. But it's definitely an evidence area we need to deepen. Dinanath, coming to you now. There is a question a bit further down, but I really wanted to get into the issue of cash transfers, because we're talking about finance and because we're talking about financing systems. The question is around cash transfers. Is it the sole duty of social welfare? And if private individuals want to support vulnerable people, is that a viable way to fund social protection systems? And so grateful for any reflections you have on the other questions that I've posed, given your deep expertise and your Nepali context.
Okay, thank you, Sophie, for that. So on this, is it just social welfare, or it can be tied up with other things like emergency social shock responsive protections and other things? Yeah, it started as social welfare. In Nepal, it started as giving monthly allowances to old age people, single mothers, widows, people from specific ethnic groups. So that it was the concept from sort of welfare and poverty upliftment that gradually it has graduated to a sort of integrated approach. So it's now has been a channel or a type of highway that everything many things could be channelized to address the problems, and one of them is shock response as well, and also the disaster preparedness activities. Like when you have early warning, you can get early action as well, for which you can pump into communities those specifically vulnerable people, such as those with people with disability, old age, family with children, all these problems. So that can be pumped, utilized as a mechanism to address problem, shocks, and risk reduction. Also, in Nepal, there are few examples that this has been tried to utilize recovery process as well. Although, so there are two good things, and one I think could be improved. So one is there are INGOs, UN agencies, all those humanitarians working with local and national government to tie up their programs with national context, which is really good, that how the national, international organizations can build on the national efforts, or the vice versa. Second thing is there are also private sector, and in our governance system, private sector have role, like they are part of a National Disaster Management Council, where they can have their say. They can bring a private sector perspective as well. But the one thing that our government, particularly the bureaucracy, could think differently is the confidence, because government is providing funding, social protection. There are at least 12 channels based on welfare, but now they are integrated into 3.5% of total GDP is invested in these pensions and all these things. But when INGOs and NGOs are trying to transfer cash, so bureaucracy is not confident on that. So bureaucracy themselves are giving out money, but if NGOs, other aid agencies are trying to work with them to give away money to the people who are in it, so that confidence is not coming. So there is the gap that national governments, bureaucracy could be confident of. They could monitor, they could better control, but I think they could open the channel so that the aid money effectively goes there. And studies show that it's sometimes 35% more effective than giving material and other things. So we have tried cash, material, technical things, credit, everything, but it is yet to consolidate into an integrated pathway so that everybody is clear. So what fits best to what, like if you are giving to children, there may be sort of different approach than to give an unemployment grant or something. So that is how going on here. On private sector, it's not only initially private sector were just considered as sort of donors during emergency, but now I think they are more actively participating. Now there is contributory social protection scheme coming in, so everybody working in private sector, employees of private sector industries, they are also involved in contributory this. There is provision of CSR, corporate social responsibility, which also has opportunity to get into the social protection schemes, support and shock response. Also, there are sort of encouraging provisions, like there could be tax waiver and all these things. That is one way that government can encourage private sector. As I told you earlier, they are in decision making as well, so they could think. But the other hand, private sector is not always honest as well, so some control mechanisms are also, so check and balance mechanisms are also necessary there. So I think I covered on that. So we have prepared disaster risk financing for this country. So it's under the World Bank DRC program, so development policy credit. It's about to get approval. So there are all these provisions that has been included. And social protection is also defined by other so many acts. So I think federal government is working to integrate all these things so that the local government can handle it better, because the outlet is local government and national government arranges all these policy things. That is. So over to you now, and if there is a specific, I'll be happy to jump in.
That's amazing. So I think there's a couple of questions in the chat as well, which open to the floor. And I don't know, Fabio, if you're still on the line, if you wanted to, yeah, I've seen a couple of questions from you. If you wanted to ask anybody directly, feel free to unmute yourself and join the and participate if you can. Otherwise, I'm happy to ask your questions for you. Okay. So I'm going to ask Fabio's questions on their behalf. So one has come in about could some of the financing options used to fund social protection expansion to respond to the COVID-19 crisis also be used to support increased social protection in normal times? So how do we do shock financing, which also might be able to cover core caseloads? I don't know who wants to take that one. The second question was about Colombia mentioning yesterday that its COVID-19 response had anticipated plans to give VAT back to the poorest households in the form of a cash transfer to make it less regressive. Does anybody have any views on that type of intervention? So kind of more of a payback scheme, which can cover core caseloads or even expanded caseloads, I presume. Stefan, Benedict, did anybody jump in with answers to those? And then we have one more on the specific role of international NGOs in financing social protection, who have limited funding availability on their own, but want to be engaged in the process. So funding core caseloads, funding for shock response takes time. You want to bring everybody on that journey with you, especially if you've got implementing partners who may be international NGOs but don't have direct money to give, but obviously have lots of expertise. How do we make that an inclusive process? So any answers to those three questions? Who wants to go first?
I think I could take up that NGO financing, which has limited, but how could NGOs, the small NGOs, could access to people in need with small resources? One approach that Nepalese INGOs have taken here is sort of a basket funding. It's not actually a basket funding, but when they reach to local government, so there is a fund, so they gather it and they channelize so that everybody is not duplicating, but they can complement each other and reach to larger number of populations who are in it. So if NGO A is working in community A, so the NGO B can go to community B or C. And every NGO may not have sufficient money, but working together, the agency with the small money also can build on the impact. It's in ratio as the other big ones do. So that is one which could manage locally. So I don't have how that could go globally, but locally that is the good strategy that our NGOs, INGOs have made here.
That's great, thank you.
The other point I could take up is can social protection scheme be responsive to shock or not? There are two things that INGOs, NGOs have tried in Nepal as concept. Is one is you provide social protection before the shock is there. Like there is a proposition that everybody knows there will be flooding, landslide, during monsoon, so June to September. So if you are paying sort of quarterly disbursement of social protection, if you paid it in May, that can be useful for the people who receive rather than paying it in November or October end. So that sort of switching in, so just making difference in time, bringing payments just earlier can be very much helpful. And also in grant system, if you are investing a lot in relief, so why not just giving them before few days when you have a sort of you have received a lot, because that can be more efficient, that can be more helpful, and people can have choices. So this is how these social protection allowances also can be utilized to help the shock responses. Over to you.
That's brilliant. Thank you. Benedict, Stefan, anything to add in?
Sure, I can start. Both the question you asked, and I actually pick up two questions. A question as well that was written in advance in the FCV, and I think you can kind of combine them. And the question on the, like, what can be used from COVID response mechanisms to cover normal loads? I would say absolutely a lot can be done to prepare for the normal load, so to speak. But what's important to focus on is on the system you're building. Right? If you're mobilizing money now for COVID response, the government's mobilized money, whether that's external money, whether it's the example from Colombia you mentioned, which is more of a tax reflow. The question is, one is an ad hoc mobilizing resources. The question is, what can you learn and institutionalize that? If as a government you set up a system to reach additional beneficiaries now that you maybe not normally would reach because either haven't prioritized it enough or because you didn't consider them to be highest priority target because they're above the poverty line or for whatever reason. If you're setting up the system now, can you use this to institutionalize it and carry it forward? And then both institutionalize the targeting system, disbursement mechanism, but also institutionalize the funding for it, maybe a budget line, or maybe some other way, right? And what Stefan talked about beforehand, or the example of Colombia, some tax mechanism or something to institutionalize this more. And the reason I say I think it links a bit to the FCV question, it's a stretch, but I think what's important to think about is that when you look at a shock responsive social safety net or adaptive social protection, I think it's important to pull it apart into three different buckets, or three different questions. One is the system itself. How are you reaching the right beneficiaries in the right place at the right time? But this is kind of the core SP work, or the core work from a lot of NGOs that are working on the ground with target beneficiaries. Then you have the question of where the money is coming from, how it is being pre-arranged and mobilized. Is it insurance? We talked about this. Is it budget funding? Is it donor funding? But there's a third bucket, which is who pays ultimately. But you can use insurance and the government pays, taxpayers pay ultimately. You can use insurance and international donors and partners pay. So now with COVID, you probably have a lot of external money flowing into a lot of countries. Well, there's also a lot of competition with countries keeping it for themselves, I guess. But it's a strong case to be made, right? And the same with conflict-affected states, very fragile states. You make it external money. Now, this external money, you still then need to think of what is the system for it to be distributed efficiently. So I think if you start pulling those questions apart, you can maybe think more sustainably, saying, what is the system that you're building and who is best placed? Is it the government? Is it international partners? Is it WFP? Is it an INGO? Is it a local NGO? And where does the money come from? I think that where the money comes from or who pays for it, that is probably more of a shifting part, right? You want to make sure that the system itself is owned in the country as much as possible, is institutionalized as much as possible. But then where the money comes from and who pays, that's more fluid in a way, because you can start mobilizing money to try and flow through that system. So if you can do this now, you can hopefully make a strong case going forward that in fact you should receive more money through this. I had one question on chat, which I can answer very quickly, maybe because I think it's important to everyone.
Please do.
And the question was, can insurance be efficient for financing frequent shocks like small flooding that happens every year? And I think short answer is no, it's dangerous because they can, but effectively they're managing your cash flow, right? If you're paying an insurance company every year to say, I need $100 back every year, the insurance company might do it, but they might charge you $120 with overhead and uncertainty attached to it. So it's called dollar swapping. It's really, you're paying somebody to manage the cash flow that you best manage as part of your budget. So it's important to keep in mind the insurance is to manage uncertainty, not to manage predictable cash flows. But ideally, when you have something like very predictable impacts, you set up a budget fund, for example, or a budget line, and you manage as part of your balance sheet. But then you can combine that with insurance to say, well, it is efficient for me to manage costs I know will happen every year, every 2 years, every 3 years, part of my balance sheet. It is not efficient for me to manage costs that might only happen every 20 years. Right? Same as you insure your car, because you don't want to set that much money aside when you have really important competing investment needs. So how can you then combine your budget mechanism with insurance for those extreme events or less frequent events? And ideally, what I said before, and have the money flow exactly through the same channels. When insurance triggers, it actually just tops up your budget fund. So the best strategy, and then you combine the two and all plug it together with the same channels.
That was really helpful. Thank you. And I should say, as a former insurance specialist myself as well, thinking through what are the good things we can take from an insurance-based approach. So triggering pre-approved financing, pre-arranged beneficiaries, without actually the insurance component, the insurance component. So much more like trigger contingency funds.
It's very important.
Yeah, Stefan, over to you. And there's another question for you in the chat about certain countries, high-income countries, I'm assuming that's what HIC means, have applied wage subsidies at the same time, haven't altered income thresholds for income tax collection for the next fiscal year. What's your opinion on the way forward for this and likelihood to apply similar approaches to other types of shocks as well? So a super technical one, but I think a really important one. And we haven't really talked about high-income countries specifically, which may have an interesting approach to thinking about financing future shocks with more options available that we could draw back into lower middle-income countries as well.
All right, excellent. I will briefly get back to Fabio's question, just to
yeah, no, in whichever order you wish. So there's a question from Ruben,
and then
yeah.
I will try to address the questions that we received in the comments box.
Wonderful.
Yes, well, it's a very good question. Yes, we are currently seeing large amounts of funds being mobilized, both at the national level and at the international level. And it's a good question to see, okay, how could that money be well spent so that it's not just responding to the short-term needs, but also strengthening systems in the medium and in the longer term. I think most of the measures that have been implemented at national level have been financed through either borrowing, reallocation of expenditure, or through foreign aid. And of course, we've seen also international financial institutions and a number of development partners have also supported or are supporting countries with loans, with grants, etc. But yes, it is of course difficult because a lot of these funds that have been currently mobilized are not necessarily sustainable in the long run. So in order to make these policies last and so that government support the social protection coverage and the expansion of the coverage in the medium and long term, and also during normal times, you would have to think about strategies how to move away from borrowing to resources that you mobilize at the national level. So this again relates to the points that I have given at the very beginning on how fiscal space at the national level can be extended. And I mean, I just touched upon the most important ones, like raising tax revenue, raising social contribution revenue, and looking at the public expenditure and how efficient and effective it is and what impact it generates. Now, at the same time, yes, what we also seen is that some countries have reallocated public expenditure. And in the case of reallocation, this is done within the budget envelope. And in this case, yes, this could be also a longer term. This could also have a longer term impact. So whatever horizontal or vertical expansion of the social protection system has taken place in a country, if it's through reallocation of public expenditure, this could be also a longer term solution. And we have in fact seen in a number of countries where crisis has triggered reforms that had then medium and longer term effects on the system, and helped to basically kickstart the reform that before never happened. This was the case in Thailand when they built their universal healthcare scheme. And now we can also see in the case of Albania, they also reallocated military expenditure to social protection and specifically for health. So I'm not saying that Albania is going to maintain this reallocation, but it's an interesting, it's an interesting approach that could also work in the medium and in the long run. Now, just a quick word on the Global Fund that was also mentioned by a colleague in the chat or in the Q&A. The Global Fund, there's currently a discussion at the international and at the global level to create a global fund for social protection floors, which would foresee to support countries, both providing them technical support to build and to expand their social protection systems, as well as to provide funding in the short and in the medium run to provide the benefit payments that they need to cover their people that that are vulnerable and that don't have any social protection benefit and any coverage. But this is, of course, again, these kind of initiatives would only work in the short and maybe in the medium run. So there always needs to be an exit strategy in place if you receive funds from outside. But there is a session on the Global Fund for Social Protection. So if someone is interested in that, this topic will be then elaborated in more detail in that session. Now, on the question in the chat, one refers to can ILO consider including climate insurance in the social protection financing portfolio? Well, what we are currently actually discussing and exploring, and this is already applied also in some country projects, is how to incorporate climate change risks and climate change events in existing social protection systems. So basically how to incorporate those risks so that social insurance in particular, so contributory funded social protection systems, how those can also respond to or can cover these kind of risks and shocks that may arise due to climate change. And this is a very interesting topic in the sense that when you have, I mean, private insurance is always a little bit tricky, because at the end of the day, of course, they want to make a profit, and they usually don't have many social solidarity and redistribution mechanisms in place, which from a social protection point of view is a key element of public social protection systems. But yes, climate insurance or covering climate risks through existing social protection systems is definitely a valid and a very interesting approach. Now, on this last question in the comments box, let me have a quick read, because I wasn't quite sure what the question is really about.
Just one thought on that, Stefan. Of course, given the scale of some of the social protection systems that we're in terms of coverage in many countries, often they do operate as a solidarity fund. It's a type of it. I mean, it could be more likened to, I guess, to a mutual insurance company, or where of course there are profits, but those profits are pushed back through into the system and they're owned by their members. Do you think that could be a viable way to, over time, of course, to build financial inclusion and build access to finance and to credit for the growth? I mean, I'm thinking more in terms of graduation. I know we're talking specifically about finance here, but over time, of course, there could be access to finance available for socials, for beneficiaries or those included in the social system, so that might be a viable way to transition out of the welfare system. And I think France's Solidarity Fund is a good example. I'm trying to recall more who are run as a mutualized version. I'm not as familiar. Maybe Benedict has got more in the Philippines, but
yeah. Well, in theory, yes, private insurance solution can work as well as public ones. But what we have seen is that those private insurance solutions that work well are those that are well regulated.
Yeah.
And where the regulation and the state actually is very active in making sure that they operate in a socially and mutually beneficial way. While in many countries we have seen that this is not the case, so the governance mechanisms and the regulation is often not good enough, or the enforcement of the regulation is often not good enough to keep them, to keep them.
No, I think that's a really important point, especially when we consider lower middle income countries as well, and the sorts of regulatory environments you would need in place to ensure that the ethos of the social protection mechanism is protected. So an interesting one for future discussion.
So just on that, I think 2 points I'd like to highlight. One is what you said on mutual insurance. I think it's very important and linked to right. When we talk about insurance, in general, we talk about commercial market-based insurance, whereas Stefan said there's a profit motive, and that's inherent. There's nothing wrong with that at all. Right? That's how the companies work. But then we need to see what is it appropriate for. But there's, to the insurance model, and you touched on that before as well, there's the expertise that comes from insurance and the non-financial benefits, in a way that using insurance mechanism, using insurance expertise has huge benefits, or can have huge benefits done right, for better planning, for better efficiency, for better discipline in public financial management. And that might mean that you work with insurance, even though some of the risk you retain, but you use the same skills and expertise to build out the system and eventually transfer some higher risk to market-based companies. And then, of course, you mentioned mutual insurance. You could also talk about self-insurance or captives for governments de facto, or regional risk pools, all ways of how you can use the insurance model and different versions thereof to manage the risk more efficiently. So I think broadening the perspective is super important. You're muted.
I knew I was going to do it at one point in this call. I think that's a really good, important point, and I think speaks to, and Stefan, to your point earlier about some of the interventions in terms of funding cause case. Like, there is not one answer to any of these problems. It requires all of the solutions, technical approaches, technical answers to be grounded in the context of both the political economy, but also the fiscal space of the country that we're working with, and also the system that's in place that might need reform or might need starting from scratch as well. So I think that's an important takeaway in terms of how we finance future shocks. I'm aware we are 1 minute over. So I will do a quick plug for the Slido again. If there's more questions, I will do a quick plug for the Google Doc, where we as experts will be going in and putting in some comments or useful references to some of the questions we've answered, or anything that we might want to add, and that's will be live until the end of tomorrow. And also this session's recorded, so if there's anything that you've missed, we will be able to, you'll be able to review it again. I should say everybody I think on here is public on LinkedIn. I think we're all on Skype, so feel free to reach out to experts. I hope that's okay, experts. But if people have further questions or anything, points of clarification, we're all still here and delighted to collaborate further. Everyone is saying there's, Alina's helpfully put in, there's full conference program. Please do check in other clinics, other sessions. Many of our colleagues and friends are deep into those as well at different points of the day, and it's so exciting to be part of a conference that's running in real time globally. It's a real privilege to be able to speak to all of the time zones in the world in a way that's much more inclusive had we met in person. So that might be a silver lining to the current context we're facing. So thank you all. Have a wonderful rest of your week. Have a wonderful rest of the conference. And thank you all for joining. Speak very soon. And thank you to the experts as well for all of your help and all of your input. It was really useful. And you're getting lots of thanks in the chat too. And thank you for being such engaging participants, everybody on the line.
Thanks, everyone.
Thank you.
Thanks everyone. Thanks, Sophie.
Speak soon. Thanks. Bye.
Bye.